All right, so today's session is compliance assessment, auditing, and what to audit. So we do have 2 more sessions, again, every Tuesday at 1 p.m. Eastern Standard Time. And so we've got 2 more sessions to go. So I'm going to run the session the way I ran the first one and basically just describe the different topics that are covered in today's meeting. So if you have any questions at all, feel free to unmute yourself and ask your questions on any of the topics. If there's anything that's confusing or you're not really sure about that, or any questions within what's being covered. And if you have other questions too, shout them out. That's what we're here for. So yeah, so what's covered according to the information, and let me see if I can open. So but if the topics came from the actual document. So if you go to the SQA website and the study materials for the RQAP exam for GLP, there is the, right now, this is it, I think. Yes, so this is the document that is available. So all the different topics that we had, sorry, hope I'm not making you nauseous, from have come from here. So yours won't be highlighted yellow. I've highlighted it when I started preparing them. And so we have the different sections. So we're in compliance assessment right now, auditing, and what to audit. So there's scheduling, you can see, reporting, etc. Okay. All right. So that's where the topics come from. So I will drop that. All right. So everything that's covered in auditing and what to audit. So we've got protocol amendments and deviations, including the associated documentation, SOPs, revisions and deviations, including the associated documentation, reporting structure of the organization, personnel qualifications, including curricula vitae, job descriptions and training records, equipment verification and or validation, including the associated documentation, computer system development, verification, validation, release, maintenance, and retirement processes, including associated documentation. Test article control and reference material characterization, dosing mixtures, concentrations, stability analyses, and or homogeneity analysis, including data, reagents, and associated documentation. Analytical method validation and documentation, chain of custody documentation. So as you can see, there's lots of documentation, shipping and receipt records for specimens and samples, data traceability, electronic and paper, certificates of analysis and associated documentation, final reports, including contributing scientist reports, phase reports, amendments and compliance exceptions, and or GLP compliance statement, accountability records for test, control, and or reference material, including records for preparation, administration, transfer, and disposal, test system randomization documentation, equipment maintenance, calibration, and repair records, temperature, humidity, and other environmental control records, study documentation, raw data, example, electronic and paper, and data calculations, including transformations, transcriptions, and derivations, example, statistical analyses and summary tables, archival process and other authorized access tracking records, animal test system history, receipt, health, quarantine, maintenance, and disposal records, study director, scientist notes and memoranda related to the study, including records documenting unforeseen circumstances, an assessment of study impact, and finding and responses to quality assurance inspections. So basically this module is about primarily your data and your reports and confirming all of the fun requirements from your study plan or protocol. And that's it. So before we jump into the question, does anybody quizzes, these are sample quizzes, quiz questions, sorry. So if anybody has any questions now that they would like to ask before we jump into those, feel free to unmute yourself and ask your question. If not, we will jump into the quiz questions. And like I said, this is a study group. It's not a training. I'm not here to tell you this. I will I will tell you what the right answer for the quiz questions, but we will discuss. Camilla, yes, please.
Just a note from the recent symposium of FDA, Health Canada, and MHRA. It's also changing the way of referencing to what we typically call documentation to say records, which implies any kind of record, whether it's electronic, whether it's paper, it could be some hybrid system. So what we are going to hear now is all about records and records review and records filing, and that's just everything. So just to be aware of this kind of change in terminology.
Absolutely, Camilla, that's a great point. So obviously, for those of us who've been around for a while, they're probably more initially back in the day, we were a lot more paper records, and more, there's a lot less paper, and it's systems and electronic data that's, you know, archived in various different ways. So there's certainly a lot of new information. The regulations, though, haven't changed. So we do our best to apply those rules to our current situations. All right. Okay, so let's jump into our first quiz question. So how it's going to work is basically we will read the question, and then we can have some discussion as to what people think is the right answer. You can put in the chat what what response you think is the correct answer, or what response you would go with, and then we can have a discussion once we reveal what the correct answer is based on the quiz. Now, before we just jump into this, just a few points, just in case this is the first time you're attending one of these study groups. The quiz itself, there is, let me reopen. So there's a lot of, I have a lot of different screens. And just to make sure I'm sharing the exact information. So the exam itself is, the information is here.
It's 165 questions, but 50 do not count.
Thank you. And I'm looking, it's in here as well in terms of the taking the exam. In terms of how much time we get, I think is it 150 minutes?
It's approximately 1 minute per question.
Yes. I thought I did see it in here somewhere. Okay, I will find it. Sorry. I'm
yeah, it's 3 hours. So if we think about 165, but we don't know which one are counted and which ones are not counted. So we should focus on every single question the same way. Yes. I mean, not skipping, like I don't like this one, so I can ignore it. So it's about 3 hours, but it eventually goes about like 1 minute something per question. So as a tip, if you are not sure if the question sounds complex, don't spend way too much time. You will have a timer on the top, so you will see, excuse me, how the time is passing. You can flag the question, move on. You may see a question that would actually help you to answer the previous one, the flag one. And then before the final submission, you still have time to go back to the flag ones, but it's better to miss, let's say, 3 complicated ones instead of spending time and missing 20 ones that would be very easy for you to answer. So it's just a strategy to go for the test.
Yes, thank you. Sorry, I'm having problems with my, why is this not? All right. We'll go back to that later. But yes, so exactly as Camilla said, it's super important as you're going through, when you're writing the quiz, if you're not sure, skip it and come back to it. A good chunk of the being successful in writing is to get through all of the questions and go back to the ones that you're not certain. Trust your gut instinct. Whatever your first response is, 90% of the chance it's going to be the right response. Don't self-doubt, because you do get into that and then you can fall down this little rabbit hole and spend like 20 minutes just on one question. If you're not sure, jump over it and come back. Sorry, there's stuff happening in the chat. All right, so, okay, people already responded. Okay, the protocol for a study says to document color clarity and whether there's particulate matter for an extract of test articles. Upon review of the worksheets for test article prep and documentation for extraction, only color and clarity were documented. What should be done? Select one. So go back and write in the data that particular matter was not documented at the time. However, it's clear because if it wasn't clear, some description of the particulate matter would have been written. Have a technical review of the omission by the study director and management and document that in the raw data. Have the study director assess the omission and write a deviation to the protocol in the data and the final report. Go find the technician that did the extraction and ask if he or she remembers whether it was particulate matter. If the technician remembers, have them document what the technician remembers. So from the chat.
We have C's, like a flood of C's. I do not see anything.
It's a sea of C's.
Yes, it's a sea of C's, exactly. So we have quite a unified approach, and you are right.
So great job. Yes, in fact, it is C. And so the response comes from 21 CFR Part 58 180E. All data generated during the conduct of a non-clinical laboratory study, except those that are generated by automated data collection systems, shall be recorded directly, promptly, and legibly in ink. So obviously something wasn't documented. As well, in 58 Part 35B5, the QAU shall determine that no deviations from approved protocols or standard operating procedures were made without proper authorization and documentation. Now in FDA GLPs, the requirement that the study director has to authorize the deviations is actually wrapped up in the QAU section, but it's still the requirement. And then under OECD principles of GLP, in section 1.2.2e, the study director's responsibility ensure that procedures specified in the study plan are followed, and assess and document the impact of any deviations from the study plan on the quality and integrity of the study, and take appropriate corrective action if necessary. Acknowledge deviations from SOPs during the conduct of the study. So just to elaborate on this, I think D was a clear trying to get someone to document something after the fact by memory. I think I think within your first month of being in QA, you know that that's a no-no. Go back and write in the data that particular matter was not documented, however, it was clear. So again, that's making assumptions. And if it wasn't documented, it didn't happen. So you can't go back unless you have supporting data to conclude. So having a technical review of the omission by the study director and management and document that in the raw data, that's part of it. But since the protocol required it, then it's definitely a deviation if it didn't happen. Does anybody have any other questions on that, or any potential other approaches, or what you may have thought might have been an acceptable response?
Yeah, both A is a speculation. It's something like it's assumption and speculation. It's not a fact. And then D, do you think anybody would really remember? Let's say a couple of weeks after the fact, seeing lots of samples, I think it's really humanly impossible to remember that, unless you have CCTV system which is focusing on this particular area, and you can go and review the recording which shows exactly, but I doubt it would be detailed enough to say whether there is or there is not any particle. You may even need some kind of lighting to put it against the light and see, is it really clear or is it not? The particles don't have to be huge. Still could be like small opalescence and still indicate there is something which should not be there. So if it's not documented, don't try, and never encourage anyone to try to say, maybe you remember. No,
Exactly.
Our
And
memory is deceiving us. Sometimes I think I clearly remember, and then I find out, no, I was completely wrong.
exactly. And the first one, it's kind of along the arguments where people say if there's step 1, 2, 3, 4, and 5, and if only step 1 and 5 were documented, well, obviously 2, 3, and 4 were done correctly. You never assume. If it's not documented, it's assumed to have not been done. So by the justification of, well, if there was something we would have documented, GLPs require you to document, not document only exceptions. Just also point out, so in general, the quiz itself, the primary focus will be FDA GLPs. There are aspects of EPA GLPs and OECD. The default will generally be FDA, but you will have those little details in the question. So when they're referring to protocol, when they're referring to protocol, for sure it's always FDA or EPA at that point because OECD calls it a study plan. And if you see terms like reference article, that's generally going to be EPA because you have your reference standards in there. So watch for the terminology and that will help drive which regulation. Now, all regulations ultimately have the core similarities. There is a document that is posted in one of the documents that you are encouraged to use as your practice and study material. It is the document that correlates FDA GLPs to EPA to OECD. So you can see the differences, and that's truly focus on any small differences, but you will see the core of it is the same. The regs themselves maybe have, under OECD, it may be a management's responsibility, and under FDA, it's just part of a certain section, but overall, the core of the responsibilities are going to be very, very similar.
Thank you, Ashton. I just put the comparison document in the chat, so anyone can download it easily, and you can do it straight away. And be sure that you have it available. We have also posted it in materials, but you can have your personal copy in your personal library. I encourage you to keep your personal library of important regulations, guidance documents, and all that. It helps immensely because sometimes we are trying to see, I can't remember the name or I can't remember the year. I know approximately what it was about, and I want to check something. If you have a well-organized library, it's your wonderful source of knowledge and a wonderful source that you can use and build throughout all your career and beyond.
Absolutely. Thank you, Camilla. And another important thing, so no stress. Some people are really good with numbers and can say, oh yeah, it's 58.853B. That's fantastic. The exam questions are not that specific. You're not required to memorize each citation. You need to know the content and how to apply it in these quick questions, but certainly you're not required to remember that it's 58 point whatever. So there is a question, will you be asked to identify if a particular regulation is applicable to a scenario? Not usually. What will typically happen is exactly as these sample questions. So across the 6 weeks of study groups, there have been 5 quizzes. So there's 30. You can actually access that online and take the sample quiz yourself. But generally, for the most part, it's going to be examples, and then this is a scenario. What would you do? Or like, what's the right answer? What's the correct action? Or things as simple as, the documentation. It included legible and accurate. What is the other one missing? So they're very simple. Some are simple. Some are very tricky. And it always goes back to what's the best interpretation based on the regulations. Do keep in mind, it may not be exactly your approach at your company. So it's always good to go back in the strictest sense, in the most conservative application of the regulations. What would the right answer be?
Yeah,
But
you
yes.
are not going to be asked a question like, in this situation, which article, which paragraph, which section of the regulation applies. No, there are no questions like that.
All right, question 2. A study plan describes the requirements of transfer of blood samples to a freezer maintained at less than -20 Celsius immediately after collection and subsequently to a freezer maintained at -80 plus or -5 for long-term storage. At the time of transferring the samples from -20 to -80 plus or -5 freezer, the study director noticed the temperature of the -20 was above -20 Celsius. What action should the study director take to maintain the integrity of study records? Document in the data, amend the study plan and change the initial storage temperature, document the deviation with possible impact, inform study sponsor, no documentation required. And again, it's a sea of C's.
Including the regulatory reference. Somebody has amazing memory. Ashton,
Good
you
job.
remember exactly where it is, where to refer if you want to see the answer. And yes, you are right. Almost.
Okay, so yes, good point. So it is actually referring to study plan. So the response, again, the regulations are very similar across, but when we're referring to a study plan, that is a good indicator that it is technically the OECD. So yeah, always read through the questions carefully. That's where you will catch those subtle differences. And sometimes there will be a little tricky thing. And if you're reading it quickly, like sometimes it'll be what action should the study director not do? And then if you're just reading quickly, you're like, oh, he should do this. And then you're like, no, that's not the right answer. Okay, so the right answer, of course, is C. So the source, again, would be 3855B5. So if you're more familiar with the FDA GLPs, because again, this situation has regulations supporting from both, but QAU shall determine that no deviations from approved protocols or standard operating procedures were made without proper authorization and documentation. And of course, from our OECD principles of GLP, it's the exact same citation from last one. Section 1.22e, study director's responsibility, ensure that the procedures specified in the study plan are followed and assess, document the impact of any deviations from the study plan on the quality and integrity of the study. All right, so amending the study plan and changing the initial storage temperature. Now, that is a potential because perhaps they really such a good thing because sometimes there is going to be subtle variation. So they may want to amend for future, may change it to what maybe your SOP allows for a, -20 plus or minus 3 degrees or whatever your SOP might have. So they may want to actually amend the study plan, but it would still, the current occurrence would still be a deviation. Okay, so let's move into question 3. So a test facility conducts a GLP test substance characterization study. So it's a test substance. The analytical reference standard is furnished by a supplier with a certificate of analysis confirming identity and purity. The study director conducts the study and completes the report with the reference standard as supplied. Considering the GLP requirements for test substance characterization, which best describes the most appropriate course of action? Select 1. Analytical reference standards do not require characterization prior to their use in a study. The lack of a GLP characterized analytical reference standard must be included as an exception to the GLP compliance statement of the final report. The test facility quality assurance unit must audit the data for the certificate of analysis from the supplier to be compliant. Test facility management must approve the use of an analytical reference standard that has not been characterized under GLP for test substance characterization studies to be compliant.
And all we have B's coming this time.
B's, yep. B's. All right. What about D? Because under the regulations, test facility management is responsible to ensure that test articles are characterized. So is that a possible answer?
Reference article. Oh, there's a reference.
Or in some instances, an analytical reference standard isn't considered. It basically, it's not the test article itself, so it can act as a reagent, right? It's for analytical standards. So, okay, so B. I don't think my arguments were convincing anyone, but so B is the winner. So hopefully the test substance and reference standard were keys that we are now talking in EPA terms. So refer to 40 CFR Part 160-105A for the correct answer. Test, control, and reference substance characterization. The identity, strength, purity, and composition or other characteristics which will appropriately define the test, control, a reference standard shall be determined for each batch and shall be documented before its use in a study. Methods of synthesis, fabrication, or derivation of the test, control, or reference substances shall be documented by the sponsor or the testing facility, and the location of such documentation shall be specified. So characterization, yes, absolutely. Thank you, Ashton. It does match 58-105. And with the exception, I think, of reference substance, because FDA, let me get my little handy regs out. Yes, in FDA, your 58-105 is just test and control article. All right, so there is no reference standard, but the overall content of everything else is the exact same thing. So, yes, no worries. And that's why I said the core of the regulations are similar across. There's obviously subtle differences, and generally, like when you're seeing stuff like that, even if you don't remember that they're referring to EPA, the overall extent of knowing that, you know, it needs to be characterized, but under FDA, there is no requirement for a GLP compliance statement, but under EPA, there is. So that would be another indicator. And the fact that we're talking about a quality assurance unit instead of program would identify that it's US, either FDA or EPA versus OECD. So there's always subtle little words in there that are going to help drive you which regulations you have to go to. All right.
Many times it's just common sense and simple logic.
Absolutely.
What makes the best sense in that situation?
Exactly. All right. Question 4. A shipment of animal feed to be mixed with the test materials was received. Upon completion of the study, it was noted that the feed had expired during the study. Which of the following is most appropriate? Select one. Reanalyze the feed and retain a sample. Invalidate all studies using the feed. Acknowledge the deviation in the final report. Dispose of the remaining supply and document the amount.
Yeah, we had this question last time, and I think people remember it. So that's why we have now unanimous answers that are all saying C, C, C.
All right.
It doesn't matter that we have the same question more than once. At least it's easier to remember.
Okay. So yes, C, 21 CFR, Part 5890G and 58185A9 for the correct answer. Feed and water used for animals shall be analyzed periodically to ensure the contaminants known to be capable of interfering with the study and reasonably expected to be present in such feed or water are not present at levels above those specified in the protocol. Documentation of such analysis shall be maintained as raw data, and the final report shall be prepared for each non-clinical laboratory study and shall include, but not necessarily be limited to, the following: a description of all circumstances that may have affected the quality or integrity of the data. So reanalyze, I did see there was an A, reanalyze the feed and retain a sample. That would certainly be helpful to address the impact So if there was a reanalysis and a sampler retained and it found that, you know, the feed itself, you know, met specifications all over again, that would certainly be a good for the study director to acknowledge, well, this, you know, it was expired when we used it on study. However, a post study analysis revealed that the, you know, diet was met the same requirements. So it's expected that there's no impact to study. And that would be a much more supportive, no impact to study than some of the no impacts I'm sure some of you have seen in your studies. Sometimes it's you know, sometimes it's like, okay, well, it's my scientific decision that it wasn't an impact. But when you have actual evidence to support, that's always, of course, a much better answer. So good, good comment on that from who suggested the A? Chris. Good job, Chris. All right, so let's move on to our final quiz question. So an individual assigned as study director for study 123's final report. However, a different individual signed the study protocol. Test facility management, TFM, indicated that the original study director left midway through study 123, and this individual took over the study director role at the report phase. What should the test facility management have done? Select one. Authorize and issue a GLP exception statement for study 123. Promptly replace the study director and document the replacement as dictated by the TFM. Write and approve an amendment replacing the study director prior to finalizing the report. Write and approve a deviation to study 123 protocol.
And I see C's and 1B, second B. Now more B's. Now there are more B's than C's.
All right, so this is a good one. This has two potential ones that I think are really similar and, you know, what needs to get done. So so we've got a lot of B's and C's. So the correct answer is promptly replace the study director and document the replacement as dictated by the TFM. So the question is, what should the test facility management have done? So should would have implied in the past. So not what should they, what do they do now? What should they have done? So again, that's a little bit tricky with the wording. So during the course of the study, when the study director left, what should have happened? The TFM should have promptly replaced the study director and document the replacement as dictated by. So 21 CFR Part 5831B and OECD Principles of GLP Section 1.2G. So 5831B, testing facility management shall B is replace the study director promptly if it becomes necessary to do so during the conduct of a study. And OECD Section 2. Sorry, I wave my hands too much and my Siri on my phone, on my watch always pops up. OECD Section 2.1.12G, test facility management's responsibilities. Ensure that for each study, an individual with the appropriate qualifications, training, and experience is designated by the management as the study director before the study is initiated. Replacement of a study director should be done according to established procedures and should be documented.
There is a question, but would the documentation be an amendment? Well, it doesn't have to be a protocol amendment. Per SOPs, there could be an assignment form, for example, or any other kind of internal template or format that is used for this purpose. It should be defined in the SOP. It's not necessarily the whole protocol amendment. I do not see personally a reason for protocol amendment because there is no change in study procedure and the procedures are in the past anyway. But there should be some kind of assignment.
I think I respectfully disagree with that one. it does need to be by protocol amendment. I think the issue that C is not accurate. This is prior to finalization of the report. So a study director should be replaced immediately, not prior to finalization of a report. That's my take on that.
Yes. I would agree with Anita. I think while the regulations, again, I think this is where we come across tricky wording, right? So the regulations don't actually indicate issue an amendment to change. So what Camilla said is correct, but I think the expectation would be that there is an amendment because, for example, if let's say if it was a multi-site study, if the test TFM replaces the study director just by memo at the site, the PIs and contributing scientists and other personnel, they may not have seen that memo. So how are they going to know, right? It's through amendment that those changes would be communicated.
Yeah.
I think if TFM issued, like if your local procedure is to do that by a specific memo and it's done, there should still be an amendment to proceed that. So that way people know who the study director actually is and has that, direct line of contact to the study director to, because I'm sure people can think of some examples where things weren't shared necessarily with QA. So if QA didn't get that memo, they'd be reporting all their audits to the wrong person, or, PIs would be communicating to the wrong person. So absolutely. So the regulations don't actually call for an amendment, but I think once that change is done by TFM, however a site does, the follow-up with issuing an amendment promptly. So that way everyone is in the know about that change, I think is just good practice. But
it depends really on the timing. If all the procedures are done, and let's say it's the time of analysis and writing the report, then the amendment makes really little sense. If it's throughout the study and the study is still ongoing, that's a different thing. But also writing an amendment takes some time, needs a review, needs an approval. So there still should be some kind of, first, this assignment. Second, immediate communication channel. I should not learn about it from the amendment, which can be like 3 weeks after the change of the person.
Absolutely. And everybody else on the line, does anybody have any commentary? But wouldn't the documentation be an amendment?
Ashton has a question, a comment in there, or question.
Yeah. An amendment is required because the protocol approval section of the protocol is changing. I don't think I've seen a study director change note in any other way other than amendment of others' experience questions. So yeah, kind of what we're discussing now. Strictly speaking, these are the direct quotes from both FDA and OECD, and it doesn't actually say by amendment. So I think amendment is the typical way that we're used to seeing it. And while generally an amendment can take time to prepare, usually if it's a change of a study director, that can get done. You can issue just the amendment for that, and that gets done pretty quick. And then other things that, changes to study design may be still in discussions, that can take longer. But yeah, does anybody have anybody on the call, have they seen either at their site or other companies they worked at or interacted with, have they seen other manners to change the study director?
Hi, this is Suzanne. Can you hear me?
Yes.
So I'm thinking, if it's not documented in an amendment, then you have an error in your protocol. And the study director is the single most important point of responsibility. So I think a protocol amendment is critical. Otherwise, it's not accurate. Does that make sense?
I would agree. I would love to see someone argue that it's not required to a regulator. That would be an interesting conversation. I think I personally haven't seen instances where it's not done by amendment, but strictly speaking, by what's actually written in the GLPs, there's nothing that strictly says by amendment. Now, I would have to do my due diligence and go back to all of our preambles, which
Mhm.
again, the preambles, if you think you don't need to read those, absolutely read those. They give you a lot of understanding of why things are in the final version of the FDA GLPs, so you can better understand the context, and that will certainly help with understanding what the best answer would be in some of these trickier questions.
Yeah, I think this is Sue again. I used to work for the FDA and I did GLP inspections. And just a note about the preamble, I think I shared this with you on LinkedIn. When I was being trained, we were trained by an attorney general, past counsel from the FDA, and he said the preamble is enforceable. And I went, really? And I don't have a document that says the preamble is enforceable, but relevant to GLP, there is something in the preamble about the master schedule, that it is raw data. And I actually used that in one of my inspections. So just a little note there. And as a test taker, I'm going to voice a little bit of my frustration over these. I did do the sample quiz. I purchased it, and I'm frustrated to hear more than one good answer to the questions.
That's the difficult part. I mean, and that's the
I mean,
whole thing. You have
the
to read.
test is $400. I want to have, I don't want to fail the test because my answer was good, but not considered correct.
I think that's the whole thing. I mean, like this one, the only and only reason C would not be a good one is because it's prior to finalization of the report, because it should be done immediately. So that's the very difficult part of these questions, at least in my opinion, that you really, really need to read every single questions and answers carefully. So that's really the main part of it. And then I did also want to say why I think that is protocol amendment is a requirement. I go back, so not to the 21 CFR Part 5831, but that the protocol, all changes to protocol needs to be done via an amendment. So until the report is written, that's why I think that it has to be done protocol amendment. So I just wanted to say that because we were talking about, there's nothing that says that the study director has to be changed via an amendment. That's what my opinion is, but that's just an opinion. That's where I come from. But yes, go ahead.
I'm sorry. What is the correct answer to this question?
It's B.
B.
It's B. The reason C is not correct is because it says prior to finalization of the report. That's the last 1, 2, 3, 4, 5 words are the one that it makes it not the best answer.
Yeah.
Right, but the protocol amendment would be written before the finalization of the report.
Well, it needs to be written immediately when the study director changes.
But immediately is still before the study report.
Yeah.
So that doesn't make the answer wrong.
The key, I get what you're saying, but it really is like, as you can see from the FDA citation, replace the study director promptly. So promptly is the key word. So I think B would have been more clearly, obviously correct if it said promptly issue an amendment replacing the study director and etc. I think that would have been much more clear that it was the right answer. But again, this is something that working at CROs, if the sponsor is not running the study themselves, there's often processes that the study is drafted, and that can go through reviews and reiterations and this and that, so it can take time. So if there's no actual study director who's overseeing that, well, there's no conduct being happened, there's still no one in control of that study anymore if the person
Right.
is
Right.
left, right? So
But the answers that you're giving, those are the same exact answers from the sample quiz, right?
Yeah.
Okay, because
Can I
I think I
provide?
got the question
I-
wrong twice.
Can
I'm
I,
like,
Can I
can I
provide?
say something?
Oh, go ahead.
Okay, yeah, as Perry said, I mean, it's again a catch of words. The questions says it, what should the test facility management must have done? So the amendment or the deviation, whatever it is raised by the study director. So what's the job of the TFM is to replace the study director, and then he or she can, write an amendment for that if it has to be done that way. So that could be, a way.
yeah,
So, like at my specific organization, we do have an SOP that states that not in an emergency, but when a situation calls that a study director or study manager of the same training, like at the same level, can sign for other study directors. And then we also put in place a designee as part of just our SOP in case that happens. So I'm not completely sure where they pulled that from far as the regs, but we do have in place that a principal investigator or study manager can sign for another principal investigator or study manager that is approved for that particular method or plan.
and I think that's from the OECD that the principal investigator can replace, or someone else can replace the study director.
Yeah, so that would make sense with the promptly because the facility has to have in place, I mean, God forbid, like a death or something like that, that somebody can sign in place of the same
Yeah.
level.
Yeah, and I think that's because I got this question wrong twice when in the practice exam. I looked it up and I found that it is in the OC. Anyway, again, I just think there should be a clear right answer.
Sometimes it's not, and that's the problem. We may sometimes think, yeah, but I don't really like any of them. None of them is really the model correct answer. That happens. So then we should choose the least incorrect one. Let me put it this way.
I think though, I personally, maybe just based on my experience, I think there are a lot of things here. It does say the individual signed as the study director for the report, but it was a different person who signed the protocol. TFM indicated the original study director left midway. So if they left midway through the study, that kind of implies that the study wasn't complete. Right? So they're not even at the reporting stage. And then someone else took over the role at the reporting part. So that to me sounds like there might have even been a gap in terms of no one overseeing it. And then it finally came time like, oh, the study's done. We need someone to write it. And then someone took it over. So then it still comes back to what should have TFM have done, not what do you do now to address this problem. They should have, once that person left middle of a study, there should have been a replacement. The replacement, I think most of us are used to seeing, expecting to see an amendment, but again, it's that prompt replacement. So perhaps some companies have a form, and then once that form is issued, then the new study director issues the amendment, but yes, there's still an amendment that changes. So I'm not so sure that it isn't clear.
Yeah,
But-
I agree with you, Sherry.
I agree with that.
Because again, I go back to because if C would have been okay if it didn't say prior to finalization of the report. That's the issue. It's like when you bring that means that, oh, it's okay as long as it's before report. Well,
Yeah.
they left midway, so it should really be immediately.
Yeah.
The director left. So I fully agree with you.
erring on the side of urgency just to make sure the study has no time periods where it's incompliant. And so
Exactly.
that's why I would pick that answer, because you just can't have a study going on without some type of study director overseeing the process. So I would say most urgent, what you would do for right now, and then you can clear it up later with an amendment, but that's not the urgency.
Yeah, I mean, you can imagine you do an audit and then you see something like this. You notice that the study director left, let's say somewhere in the middle of the study, but you do not see the assignment of the new one until somebody realized, we need to sign the someone to sign the report. So in that case, something should have been done and maybe was not done. And I can see it now and see, and in my observation, what I'm going to write, but it should have been done promptly, because that's the regulation, that's the sense of the regulation. And like somebody, Barakat pointed here, looks like it was a smooth study, no study director was needed. So facility management, we get this, yeah.
All right. There is a comment from Sunitha asking to share the link for the preamble. So if you actually go to the RQAP candidate handbook, on page 15, we do have the GLP proposed rule. So the link is right there, and you can download that, and that is your preambles here. It's the questions with it and supplementary information, proposed changes, and why. There were several similarly with test articles. So they explain the rationale in this. So this is definitely a good document. There are potentially other ones as well. Preambles 1978 are right there as well. So the links are in there, Sunitha. So definitely go on the SQA website. So if you all go to SQA, sorry, I'm just taking a bit of time just to, because if I post anything in the link once we close the meeting in a few more minutes, you'll lose all of that. So I just want to point out now, but I'll also send it to Lydia so we can put that in there.
Quick
But
tip.
yeah,
If you open the chat, on the top, you have 3 dots. You have RQAP-GLP study group session. Then there are 3 dots. If you click on the 3 dots, you see save chat, and you can save it. And it will be sitting again on your computer, in your folder for downloads, and probably downloads Zoom subfolder. So you can always have that. If there are any links or anything that you would like for later reference, this is the easiest way.
Before we close out on this question, this is Sue again. My memory is that I picked that first answer that you said, promptly replace. I agree, that sounds like the best answer. I don't think but I thought that my memory is that I got that answer wrong the first time, and that I finally, after doing the test, practice test twice and getting that answer wrong twice, I thought, well, must be this amendment is the correct answer. So that's why I'm not advocating that the writing of the amendment is the right answer. It's just kind of from my experience with taking the test.
okay. Yeah,
I'm going to look over my answers again now that we've had this discussion.
But you're correct, though. I mean, that's in my opinion, it was very difficult unless I read, especially when you're time crunch, you're trying to hurry up and do all of this stuff. It's sometimes you lose to read every little detail. But what you said is absolutely correct, is that when you're reading, you just answer, well, it needs to be an amendment, so it's prior finalization, so it's no big deal, it's C, but so
but
many
that's not what happened to me. I went to C because my other answers weren't right, so I said, I guess it has to be this one. But again, it's just my memory, and and I'm also taking the GCP quizzes, and I found some of the answers were not right either. I didn't agree with the answers from that we went over. So I'm finding the questions have a lot of debatable answers.
Mhm.
Yes.
Chris just posted in the chat, why not A for not having an SD during the study? And I agree. I think many of them are, C definitely makes sense. A makes sense. I think, again, it comes down to what's the first thing that TFM should have done.
Yeah, that's the key again. It
And
was the question.
yeah.
Yeah.
So
Yeah.
once that happens, then their responsibility is to replace the study director. So they replace it, and then that new study director is usually the person who's going to issue the amendment, right? TFM doesn't issue amendments, and then TFM also doesn't issue study deviations. So again, at that point, the study director, had they not been replaced promptly, they would have said, okay, well, this study went, a year and a half without a study director, and we would put that as a GLP exception and say, but during that time frame, there was no additional work and there were no deviations that occurred, and etc. So absolutely.
Yeah, that's why every little sentence, every little change in the answer or the question matters.
Yeah.
So
I
take
think
your time, but
I think that's a good point that you bring up. It's the study facility management's responsibility to ensure that there is a study director.
all right. Well,
I'm going to check and see if that's the right answer in the practice quiz. It seems so obvious that that's the right one.
Yes, that is the response. Like Lydia from headquarters, she had actually run it. She just randomly selected responses and sent us the actual quiz questions with.
Okay.
When you get it right, it tells you, yes, that's the right one. Or if it's wrong, it says, no, sorry, this is the correct answer. So this is it based on the document that she provided to us.
Okay.
Yeah, again.
Yeah, I took it as well. And although I'm not a GLP expert, and this applies just to the exam, practice exam, most likely I would fail at the real one. But simply saying, okay, what would be the logical thing? What would just somehow like, okay, this is common sense, this is logical thing to do, and I got it. I got it like 100%. This small sample. So I was thinking like, okay, you cannot leave it like you should not have a gap. There should be somebody who is in charge, even if there are not many activities. Still, this is, and that's the management responsibility that nobody can do on their behalf.
Yeah, I think I don't think that this is an ambiguous answer. I think that's the correct answer. No. I'm going to check my test.
All right. So I hope this was helpful. Again, it's always it's nice to see we had one that was really clearly obvious that there could have been, not misinterpretations, but like you really had to like write and approve an amendment. Well, TFM doesn't usually write the amendments, right? Write and approve a deviation. Well, TFM doesn't usually approve and authorize a GLP exception for a study. That again, that's the study director's responsibility. So it's coming back to responsibilities, not necessarily, write and approve an amendment. Yeah, that's great, but should TFM do that, right? So it's all just in the subtle wording. Not every question will be like that. So don't stress that, there are certainly going to be some that are a little bit trickier and you have to really take the time to pause. But if you're not, put in a response and come back to it later. Because again, it is a bit of a time crunch.
One more thing here. If you see it as a process, look at all the answers as a process, then there should be like step 1, step 2, step 3, and so on. So what is the step 1 we are looking? That if it's not there, then the next step cannot follow. So have this kind of logic, seeing it, yes, all of them are fine. but one of them must be the first one.
Absolutely.
Yeah.
All right. So thank
Okay.
you all so much for attending today. Hopefully you'll join us again next week and the week after for our final 2 sessions. If you aren't able to join, we do wish you luck in your exam. And again, you know, approach the exam, take your time reading it. If you have to pause and really think about it, highlight that one and come back to it later. There is actually a way in, even if you're doing it online, to note it, so that way you know which ones to come back to, and then get through all the easy ones, and the ones you might have to think about later, come back to them.
Are there other sessions that we've had to date recorded?
Yes.
The
Oh,
previous,
I'll look it again, look for them again.
it
Thank you.
takes usually a couple of days for the recording to be posted. So if you look for this recording tomorrow, you are not going to find it. But it's Tuesday, so if you look like next Monday, it should be sitting there.
All right. Thank you so much, everyone. And thank you, Camilla and Anita, for your input and great discussion on this. And thanks for all of you.
Thank you.
Bye.
Bye.